We're going inside your health now. A lot of moms will be celebrating Mother's Day coming up on Sunday. For a few, this celebration is a bit unexpected because their pregnancy was actually a side effect of taking injectable drugs, GLP-1 drugs. We're talking about Ozempic, Mounjaro, Wegovy. Well, our health expert, Dr. Archelle Georgiou, is here to explain why these medications are being associated with surprise pregnancies and what women need to know. So, first of all, how common are these surprise pregnancies right now, Archelle?
So we don't have a lot of good data to answer that question. And like so much news today, we're seeing the indications of it on social media, in Reddit groups and Facebook groups, and there's a lot of them. But here's what we do know, Leah. For women that are taking these medications for type 2 diabetes, they've been taking these meds since 2018. And they have been studied of how frequently women taking these medications are getting pregnant. And it was low, and it continues to increase and increase. The slope of that curve is quite steep. So it's happening often. We don't know exactly how often.
Okay, do we know why this is happening potentially?
There are a few different assumptions about why it's happening, and it could be a combination of all three. Okay. The first is that there's about 12% of the female population that has what's called PCOS, polycystic ovary syndrome, and that is a hormonal imbalance that often makes women infertile. So women may have this condition, think that they're not fertile. They're often overweight as well. They're taking these weight loss medications. Even the smallest amount of weight loss can reverse the hormonal imbalance enough to induce fertility. So these weight loss drugs cause 15 to 20% weight loss, and even 5% can really switch over when you're PCOS from infertility to fertility. So that's some nice good news for those women. The other is that oral contraceptive pills may be less effective in women who are taking these medications. And that's because these meds decrease slowing of the stomach, decrease some absorption, and they may decrease the absorption of these pills as well. And the third thing, not being written about as much, but I think it's a possibility, is that people who are feeling more comfortable with their bodies may be more comfortable being sexually active. And I'm not just talking about women, but men as well. And so increased sexual activity leads to more pregnancy.
Wow. All right. Well, let's talk then about the drug's potential side effects, specifically on a baby then. If you're taking the medications and you don't know you're pregnant, how does this impact the baby?
Yeah, lots of concerns about this. And once again, I'm going to say that we don't know definitive answers on that because it's very complicated to do these sorts of studies on pregnant women. The manufacturers of the drugs are putting registries together so that they can figure that out, but those results won't be out until 2027. What we do know is from animal studies. And in animal studies, these GLP-1 drugs do decrease fetal growth and weight, and they can affect the pregnancy, the fetus, and it also gets secreted in the breast milk. And so it's not recommended that you take these medications during pregnancy or lactation.
Okay, so if you're taking this and you get pregnant, you may want to stop taking it. Consult your doctor first, right, of course.
Well, always talk to your doctor. If you're taking it for diabetes, the benefits may exceed the risks.
Yeah.
If you aren't diabetic, then you probably should stop taking it. And if you're taking oral contraceptive pills, you want to switch to a non-oral form of contraception.
Okay, so especially for women who are treating diabetes, this is an important thing to keep an eye on.
Absolutely.
All right. Dr. Archelle Georgiou, thank you so very much. We will be right back.